Hey guys, so it's Miss Woodruff here. I'm doing another focused clinical assessment video. This one is going to be over the musculoskeletal system. So we're going to be talking about how you do a focused musculoskeletal assessment. Keep in mind your instructor may want you to do a little more or a little less on this. Always check with them. This is just the basic principles video to show you some of the things you may need to do for a patient with a musculoskeletal problem. So to get started, first let's talk about, like we always do with every patient, we always want to look into the past. So what kind of past musculoskeletal problems can a patient have? Most of what we talk about with musculoskeletal problems is going to be stuff like joint issues like arthritis. Maybe they have a history of joint replacements. They also could have problems, with general weakness. Maybe they have a previous injury. It could be something with their brain, but maybe it's affecting their physical weakness. They could have chronic back pain. They could have had back surgery, disc issues with their neck or their back. They can also have, different chronic diseases that make them weak, like multiple sclerosis or ALS. There's a variety of things. So you always want to get into their history. Have you ever had any problems? And when you're talking about musculoskeletal, remember that there's the muscles, there's also the bones. So, do you have, like, you want to be very specific. Have you had any problems with your joints? You may be able to see it right when you're looking at them. But, most of the time, what we want to be doing is we want to really be in depth, asking them their questions, because it's really good to see where the patient's at. Do they know what they have in their history? So joint problems or bone problems, that we want to ask about any problems with their muscles, weakness, any problems tolerating activity. How's their day-to-day look? Are they able to get up and move around okay? Do they use any devices at home? Do they need any special equipment, stuff like that in order to get up and walk around? So we start with that. Then we're going to, ask about current symptoms. Probably one of the biggest symptoms people have with the musculoskeletal system is pain. Do you have any pain? And you might want to be specific. Pain in your neck, pain in your back, pain in your joints, pain in your legs, pain when you walk. There's a lot of different pain questions you can ask, but you want to be very specific. And especially before you have them do something like range of motion, you want to see what their pain level's at, to make sure that you don't cause them any problems or don't, make something worse. You're like, hey, does this hurt? So you definitely don't want to do that. So kind of see where they're at with their pain. You may want to ask about any joint swelling. You might want to ask about any joint problems, any abnormalities in their joints. You may want to ask them about any swelling or inflammation anywhere. And if there's like anything abnormal that they've noticed. And then ask about weakness. Are they having any weakness anywhere, one more than the other? Um, and so then when it comes to, the first part of our assessment is a lot of what we want to do first is inspect, as always. So I might start over here. Here's my patient Cliff. I might start here and I'm going to be looking at their joints. I'm looking at their joint spaces to see if there's any swelling, abnormalities. I would look on both sides. I'll start with their upper extremities. I'm looking for any swelling. I'm going to look in the hands, maybe look at the elbows, look at the shoulder. You can also, while you're doing that, you can also if you want to be feeling for any differences, sometimes, if you're feeling along, you might notice any swelling, or maybe there's some particles that are collecting in the joint, so you might want to be looking for those. Then I'm going to have the patient perform some range of motion. So there's two things that you want to do when you have them perform for musculoskeletal. You want them to do range of motion, and you also want them to do strength. So for muscle strength, you're going to have them push against your hands. So I would have them push, and then so that's kind of like this, like they're going to push against my hand, and then I'm also going to put my hand like this and tell them to pull. So then they're going to pull. So they should push and pull. That way I can see that. And you need to do both against resistance, so that way that they can kind of see. So you can tell them, like, don't let me push you, don't let me pull, or try to pull me, or don't let me pull you. And so you can word it whatever way you would like, but pretty much you're pushing and then pulling up against them so that you can kind of see both sides of their muscles, because maybe they're strong in one muscle and weak in another. You also want to do hand grips, because like a lot of people will test hand strength just with a hand grip. My hand could be strong, but I could have no arm strength. So you always want to do hand grips first. I usually do hand grips first, and then tell them push and pull against resistance. And when you pull against resistance, I put my hand behind theirs and they pull back, and I'm trying to stop them, if you weren't sure about that. Then I'll probably have them do range of motion. So I'll have them kind of like I want to test every joint. So maybe shrug your shoulders, bend your elbows, move your wrists. Can you move your fingers? I want to make sure that they can move every part on both sides. And I really want them to do it the same, like with the hand strength and everything like that. I always want to do it bilaterally because if I do one side at a time, it's not going to give me a clear picture if they're equal. And just like with pulses and everything in the cardiovascular system, I always want to make sure that these are equal bilaterally. If they have an injury, if they have a cast on, if they're suffering an injury, obviously you're not going to have them do that. You are going to check their neurovascular status and stuff like that, see if they can wiggle their fingers, but you don't want to create an injury. So if there's any injury, that's why you always ask history first and make sure that they don't currently have any history or current symptoms in that area. Because maybe they're sitting there, you ask them, hey, do you have any pain? And they say no, but then you're starting to move their joints and they're like, that hurts. So you always have to be very specific when you ask about pain. Because some people say, no, I don't have any pain. But then you ask them to move their joints and they're like, well, now I do. So anyway, so upper extremities, I had them do the hand squeezes. I had them do pushing and pulling against resistance, range of motion, moving all around. So now I've assessed their upper extremities. Now I'm going to move to their lower extremities. So for lower extremities, I'm going to do the gas pedal where I'm going to put my hands on the bottom of their feet. I'm going to ask them to push down on my hands like a gas pedal. And then I'm going to put my hands here and tell them to pull up like this. And they're going to pull up as much as they can against my hands in order to see how well that they do with that. Then I'm going to have them wiggle their toes, roll their ankles. And then I like to have them, if they can, bend their knees like this, see if they can bend their knees as long as that's not going to cause injury. In that test for muscle strength, I should back up. The one thing I forgot to say before I move them, always want to do before you move, you always want to inspect first. I did forget to mention that. Inspect, because a lot of people are going to have previous like knee replacements and stuff. Look for scars. Look for any scars on their major joints here, or maybe on their hips. They may have like a previous hip surgery. You always want to look for any swelling here in their joints, any problems. So always inspect first before you move them. So a little lesson for Miss Woodruff to herself. So yes, inspect, and then you're going to do that movement with them. Like I said, push and pull, push up against my hands like you're pushing on a gas pedal, pull up against my hands, and then you're going to have them bend their knees if they can. If the patient's able to after, it'd be great if you can assess their gait. And if it's not a great time for them, maybe they recently got up or they don't need to, you can wait till the next time they go to the bathroom. But you do want to see how well they can get up and move around. Are they weak? Are they unsteady? Do they need to use special devices? Do they need a lot of your help? Are you pretty much lifting them out of bed? Can they even walk? What's their ability? Because I've had patients that are young, healthy, they can do all the muscle strength, but when they went to walk, they had nothing. So you always want to test for that because it definitely tells you their safety. You always want to know what your patient's fall risk status is. We do fill out a scale in the hospital on that, but a lot of times you don't know till you get them up. So I may assess for gait. Depending on the patient's history and stuff, I may look down their back and assess for any abnormalities in their spine. I want to look at their posture and how while they're walking, look at their posture and see how they get up and how they move around. And just looking for any abnormalities there. But that's a lot of what I have them do. You can have them go more in depth and look at things like, depending on, where they have, like, let's say they have neck pain, I might, have them do neck range of motion, things like that, or shoulder range of motion. But mostly we focus on the upper and lower extremities as those cause the most problems. So to kind of sum up about and one more thing before I move on. The other thing you might want to do, depending on the patient, especially if they have a history of arthritis, let me show you this real quick, is that, like, let's say while they're bending, I can either feel for it, sometimes I can even hear it. You're going to hear kind of a grating sound, and you almost hear it with this thing. It's what you call it. So if I can either feel or hear kind of a grating sound or a grinding sound with their joints, they may have what's called crepitus. And crepitus is a result of bone on bone rubbing together. It happens in osteoarthritis. So I might also be listening for that. And a lot of times you can just hear it. You don't even have to feel it. But, it's definitely like a grating sound that you can hear pretty well. So that's the only other thing I would check for. So to sum up, we want to get a really good, thorough history. Make sure they don't have any joint problems right now, no joint pain issues. I'm going to get the thorough history, current symptoms, and then I'm going to inspect. I'm going to inspect head to toe, look for any scars, swelling in the joints, problems in the joints. any obvious, what do you call it, recent or past surgeries, any obvious injuries or problems. And after I'm done inspecting, then I'm going to have them do some movement. I'm going to have them do hand grips, push and pull against resistance. For the feet, push and pull against resistance, and then do range of motion as well for both. Get all those joints moving, just see, make them do a crazy wiggle dance and see how their joints can move. And then just making sure to document any changes. This is a great opportunity to see your patient's other needs. Maybe your patient's in the hospital for pancreatitis, but they've gotten incredibly weak. They need to work with physical therapy. Maybe your patient's in the hospital for a respiratory issue and they're not having good activity tolerance. They can't breathe and walk at the same time. So they may need to work with, a pulmonary or cardiac rehabilitation. So there's a lot of opportunities for you as the nurse to use these assessments to collaborate with other team members and give your patient full, complete care, the best care possible. So I hope this video helped. I'll see you for the next one.